Hi, today I'm going to be presenting on integrative care. So, just a moment. Let me get my presentation started. Okay, so as I said, today I'm going to be presenting on the integrative care model, specifically as it applies to psychotherapy. And just to give an overview of some of the topics I'm going to be speaking about, I will begin with giving a sort of brief definition as to what the integrative care model is, how we can go about creating a holistic treatment model, patient-centered care, the collaborative care model, which is sort of an offshoot of integrative care, implications for us psychotherapists or psychotherapists in training, such as me, and some concluding thoughts. So the integrative care model sort of is, as it implies, it is a model based on integrating care from different kinds of clinicians. It requires collaboration between physicians, mental health experts, as well as other experts, for instance, social workers, nurses, all sorts of people, in order to best address the client's needs. It was introduced in the early 90s and has grown in application as well as acceptance or tolerance within the medical as well as mental health fields. Physicians began working alongside mental health workers, and thus this allowed them to treat the medical issues that the client presented with, while the mental health practitioners tackled the client or patient's comorbid presentation of mental illness. And thus, by combining mental and biological health care, we are thus moving towards creating a single holistic model. And I like this quote because I think it captures sort of the essence of an important part of the integrative care model, but it also does so by drawing on an aspect of the therapeutic field. So from a larger perspective, the future of healthcare will depend on therapists, medical professionals, and other professionals learning to deliver the kind of care embodied in this therapeutic field. And just to sort of touch briefly on the prevalence of comorbid mental health disorders, specifically within the United States, you can see that in my opinion, the numbers are quite staggering. More than 90% of the patients polled in this particular piece of research reported some kind of co-occurring mental health disorder. More than 60%, more than 62% to be specific, reported major depression, 23.5% reported panic disorder, 34.4% reported social anxiety disorder, 37.6% reported alcohol use or dependence or substance use disorder, and 17% reported bipolar disorder. And I wanted to look at the prevalence of comorbidity outside of the US, but sadly the statistics referring to the non-developed world, for lack of a better term, were very, very scarce, so I'm sad to say. But from what I was able to gather, generally speaking, the rate of comorbidity is estimated to be about 25 to 40% of people within the developing world. And on the left side of the slide, you will see quite an extensive list of on top biological or medical disorders, and below that some numbers referring to commonly occurring mental health disorders as well. So in my opinion, no matter how you sort of look at it, there's quite a correlation, and I think that it's sort of it's incumbent upon us as members of a helping profession and as therapists or future therapists to A, be aware of this, and B, do what we can to figure out how to deliver the best care that we can for clients who are presenting with more than one disorder. So how do we do that? Some of the key attributes that I found within the integrative care model are, firstly, is collaboration. Obviously, collaboration between physicians, or even specifically primary care physicians and mental health workers, allows the physicians to really tackle what it is that they specialize in, biological issues, while mental health professionals are given the space to treat the comorbid presentations of whatever mental health disorder or disorders that the client is presenting with. This goes a long way, in my opinion, toward creating a holistic care model, which is essentially combining mental and biological health care into one model so as to be applicable to a wide demographic of people, but also be able to be individualized at the same time. And we go about this by sort of allocating multiple clinicians to serve one client's need. Primary care physicians are often sort of the experts in the terms of treating their clients for a number of reasons: length of relationship, how many times the client has seen the specific physician, a lot of reasons. But it often happens that the primary care physician takes notice or is told about a client's mental health symptoms along with the client's presenting biological symptoms, and this ideally would allow the physician to work alongside mental health professionals to treat the comorbid psychosocial issues the client is presenting with. And another crucial, and I think perhaps maybe the most important piece of the integrative care model is its patient-centered nature. Studies have demonstrated that not only does patient-centered care tend to increase patient involvement, it also produces better outcomes overall. So both of those reasons, in my opinion, are reason enough to focus on this as a central aspect of any sort of approach or modality. And one sort of breakdown of an integrative care model that I came across divides it into 5 sort of general phases. The first phase is called patient briefing. This is essentially confirming whether the patient has been seen before and what that person's presenting issues happen to be. The second phase is called introduction. This marks the initiation of direct patient contact as well as introduction to the integrative treatment model, introducing the patient to that model. The third phase is called elicitation of the illness. This involves identifying the reason for the patient's visit, as well as a review of the person's medical records. And also, this is when the majority of the client's biopsychosocial assessment is performed. The fourth phase is entitled intervention, and it's typically split into 2 phases, wherein various interventions are employed, and I think this speaks by and large, perhaps exclusively, but I didn't want to take that leap, to those of us in the mental health half of this, or I shouldn't say half, the mental health portion of the integrative care model. It can include anything from the use of hypnotherapy to solution-oriented therapy and a lot of other modalities. And the 5th and final phase is called relaying information, and this is just as it says, it involves the passing of information gathered onto another medical provider in one of a few ways, either verbally or through written or electronic healthcare records. So that is the general model that I sort of came across. And another kind of a model, which is an offshoot sort of the integrative care model, is the collaborative care model. And I found a quote which I think very well encompasses what this model is, and it is a form of integrative care that, quote, operationalizes the principles of the chronic care model to improve access to evidence-based mental health treatments for primary care patients. And similarly to the integrative care model, it has 4 key components, those being that it's team-driven, population-focused, measurement-guided, and evidence-based. So just to go a little bit further on what I was just speaking about in terms of the 4 critical components of the collaborative care model, the first being that it's team-driven, allows for a multidisciplinary yet also coordinated care, and this allows a variety of expert clinicians to be able to put the best aspects of their training to use so as to deliver the best possible care for the clients presenting disorders. The second phase is that the second component is that it's population focused. This refers to a team effort intended to serve a very specific population, and this is what the provision of care is and the specific health outcomes depend upon. Next, the measurement-guided component refers to, quote, systemic, disease-specific, patient-reported outcome measures, which are an example of which would be something like symptom rating scales, and those drive clinical decision-making, which is, again, in my opinion, an excellent sort of example of how patient-centered care in action, I suppose, is a good way to phrase that. And lastly, it's evidence-based. I know we throw that term around a lot here at Antioch, but in this particular circumstance, it refers to the adaptation of scientifically proven treatments which are individualized in order to improve health outcomes. Okay, so integrative care and its implications for psychotherapists. So as I sort of briefly touched on before, one approach to psychotherapy really suggests that the individual therapy component of treatment ought to be brief and outcome or functionality focused. And when it comes to family therapy, there's an emphasis on the systemic and relational aspects, which is important to maintain within this model. And it also suggests that modalities such as ACT, motivational interviewing, mindfulness, and CBT perhaps should be modified to further emphasize or reflect the relational emphasis present within the integrative care model. And lastly, postmodern modalities like solution-focused and narrative therapy, as well as cybernetic modalities like, I'm sorry, I have solution-oriented on there twice. I apologize, that's an error. Cybernetic modalities such as Ericksonian therapies are uniquely suited to fit within the integrative care model. So what I sort of gather from that, generally speaking, is that we as psychotherapists, those of us at least who intend to try to follow the integrative care model, might have to sort of separate ourselves a bit from theory as we understand it in a traditional sense. So we might have to shorten the duration of planned treatment. We may have to, like I mentioned, place more emphasis on relational aspects. And there are there's some adaptation that needs to be made, but I also think that by sort of partnering with physicians, this most certainly it goes a long way to provide a more holistic orientation towards treatment, which I believe would be us providing the best care that we are able to. I'm sorry about that. Okay. And in terms of some more implications for future patient care as far as the integrative model is concerned, I think that there's a strong possibility of the introduction of further integration-based models. For instance, medical family therapy was developed within an integrative setting. And the aim of this model was to alleviate the responsibility of primary care providers of having to quote, or having often been left alone to maneuver and wade through the myriad of biological issues that their patients have, while at the same time being expected to address their concurrent psychosocial ones as well. And the next sort of implication that came to mind for me was that the more we place emphasis on the importance of patient-centered care, I think that, again, there may be the development of more patient-centered modalities, or perhaps the adaptation of existing ones in order to make them more patient-centered. And lastly, the implementation of integrative care creates opportunities for new study and also, in my opinion, better patient outcomes. By introducing this sort of treatment modality, if you want to call it that, its creators have created or have paved a way to study, and we are also now able to measure the clinical, financial, and operational outcomes compared with other non-integrative modalities. So in my opinion, it is most certainly a promising start towards adapting integrative care sort of more widely, and establishing sort of an existing and more permanent partnership between the mental health field and the behavioral health field and physicians, so just the medical health field. So I think that in doing so, if we're going to properly treat patients suffering from comorbid disorders, I think that patients deserve expert care, and they deserve expert care in every avenue of their treatment. So in order to provide that, I feel as though partnership is necessary. We need to work together. We need to collaborate and integrate our care. So that is my presentation. Thank you very much for watching. And those are my sources. So please feel free to shoot me an email if you have any questions. And thank you again.